making this type of hand shape, you place the hand on the mid-back and you slide down 2 sets of muscles, the paralumbar muscles, because they run parallel to the lumbar vertebrae. So you slide down until you hit the iliac crest. So using your right hand, and you're standing on the left side of the patient, if you're right-handed. You then slide your thumb across to the center of the spine, and your thumb will have the pad of the thumb pressing onto the skin. You slide down a fraction, and you change the angle of the thumb so it's vertical, so the point of the thumb, the nail end, is now pressing onto the skin. And if you press in, you'll find that you've slipped into a depression. And that gap is the gap that's located below lumbar vertebrae number 4, below L4. And if you press, you're going to leave a little indent mark from your nail. So you've located L4. That's how you locate L4. After you've located L4, you reduce the pressure and lift the thumb up, over and down, and then press in again, and the nail of the thumb falls into another gap. This gap is located below L5. And you know it's L5 because when you press the pad of the thumb downwards towards the heels of the patient, you can feel the pad of the thumb pressing against the raised ramp or the raised wall of the sacral bone. So you know you're below L5, which is just above the sacrum. And again, your thumbnail is going to leave a mark, which is L5. So far you've located L5 and L4. That's how you locate L5 and L4. Now, just here is the lower border of the scapula, or the shoulder blade. If you can't see the lower border of the scapula, you can take the patient's arm and gently lift it up behind their back, and you see the shoulder blade sticks out. Then you place the arm back, because now you can see where the shoulder blade is. So just gently push the shoulder blades forwards and down to make sure they're resting comfortably. Then you know that when you make a horizontal line along from below the lower border of the scapula to the spine, that just below that you've located T6, and just above that T5, thoracic 5 and thoracic 6. There's the lower border of the scapula. You go across, just below it is the gap below T6, and just above it is the gap below T5. So you've located lumbar 4 and lumbar 5, and thoracic 5 and thoracic 6. And then what you could do, I call it marking up the spine. You just draw a little line in the gaps that you find between each of the vertebrae. T2, T1, and cervical vertebrae 7. So with these numbers, whenever I mention them, what I'm referring to is below that vertebrae. So below C7, below T1, below T2, yeah? And that's how we number the spine. So you've located L4 and L5, you've located T5 and T6, you've made a little mark and filled in the numbers for the rest. Now, I know that this is C7 because I've counted up to it. However, there's an additional method for locating the correct location for C7. You put your hands here, you just lift your torso up slightly, but drop your head down. One of the bones sticks out, that's C7. You put your thumb on it. Can you turn your head side to side? C7 doesn't move, but the one above it, C6, can you turn your head again? You can feel it moving. C7, turn your head again, doesn't move. C7 is the first non-articulating vertebrae in the spine. If you go down again, that is a way of confirming the location of C7. Any questions so far about anything we've done so far? So, below C7 is an acupuncture point called Governor Vessel 14, which is the meeting point of all the yang meridians. When this point is done in the reducing direction, it clears the heat from the upper body. 1.5 inches beside T1 and T2 is bladder 11 and 12, which is the wind gates. Below T3 is lung shu to control the lungs. 3 inches beside T4 is Go Feng Yu to strengthen the lungs and all the other internal organs. T5 is the location of the emergence of the cardiac nerve, and 1.5 inches beside is Heart Shu. Heart Shu is supported by T6. Below T9 is liver, below T10 is gallbladder. 1.5 inches beside T11 is bladder 20, which is spleen shu. 12 is the stomach, and 1 is the triple warmer. 1.5 inches beside lumbar 2 is kidney shu. If there's soreness or tenderness on L5, it not only means a problem on L5, but indicates exhaustion of the lumbar vertebrae, which can only be healed by not only treating L5, but doing the kidney formula at the level of L2 to strengthen the kidneys, to strengthen the bones and the area of the lumbar vertebrae. The next thing I'm going to do is cover over Lottie's back and take you through the kidney formula and the sciatica formula. So, before we acupuncture the back, we need to do a quick punch on bladder 40, located in the popliteal space. So, you put your finger where you think the point is between the two tendons on the crease, and then you bend the knee and your finger will sink into the depression, which confirms you have the correct location. For anatomical reasons, this point can only be punched in the vertical direction. And then you do a reducing manipulation, and then you remove the needle. So that is bladder 40 with a quick punch and a reducing manipulation, which clears the whole of the back before you start working on the lower back in cases of sciatica. First we're going to do the kidney formula. So there's an acupuncture point called Governing Vessel 4, which is located below lumbar vertebrae number 2, here. So we use a 1.5 inch needle, 40 millimeters, and we insert it all the way in. Then, to locate bladder 23, we use a 1.5 inch needle, so now we've got a marker, but also it's located on the high point of the paralumbar muscles. And then we're going to do bladder 23 on the other side. Now, that's your basic kidney formula, but we expand the formula and we add to it bladder 52, so we add to it this point, which is 3 inches beside on the second branch of the bladder meridian, and we also add bladder 24, which is 1 inch below bladder 23. So this is the full kidney formula. Bladder 23, 24 and 52 reinforcing, pointing downwards in the direction of the bladder meridian. Governor Vessel 4 located below lumbar vertebrae number 2 against the direction of the governing meridian to reduce. So we're strengthening the kidneys, these points are on top of the kidneys. Bladder 23 is kidney shu, kidney control point. All that's reinforcing. To clear off any excessiveness we may be creating, we do Governor Vessel 4 reducing. And that's the kidney formula. Now, another technique you can use if you're finding it hard to locate the gaps below the vertebrae. So for example, if I was trying to find the location of bladder 24, and I knew it was 1.5 inches beside and below L3, I'd have to identify exactly where L3 was. So you feel roughly where it should be, but if you place the handle of an acupuncture needle over the gap and you press on it, you can feel the handle slip into the gap between the two vertebrae. And of course, when you take the needle away, there'll be a line left from the pressure of the handle of the needle, which you can then mark so it's clear where it is. Now, Lottie's got a problem with her right leg, and the nerves that emerge from between L1 to L5 control the section of the outside of her right leg. So what I'm going to do is I'm going to do the whole of the governing meridian from L1 all the way down to L5 on the governing meridian, and then what I'm going to do is 1/2 inch beside on Hua Tuo's extra points, I'm going to do reducing. So if I was to place a 1-inch needle across, then clearly half that distance, if it's a 1-inch needle, is 1/2 inch. The direction of the energy flow in Hua Tuo's points is the same as the bladder meridian. It's down. Therefore, the reducing direction for Hua Tuo's will be pointing upwards. So, I'm going to do all the Hua Tuo's points on the right side, because the problem's with the right leg, in the reducing direction. And what Hua Tuo's does is it can inhibit the hyperactivity of the nerve, so reducing the sciatica type pain that's going down the outside of the right leg. Now there's extra points above the hip, we call the above the hip point, and for anatomical reasons we can do a vertical punch on this point because there's nothing underneath it that we need to worry about. And there's another point called the below the hip point, which is tender, which will also do reducing. And we're just going to do it on this side as well. Because it's also tender. Now, I've done Hua Tuo's on the right side because she just definitely has a problem with the right leg. I'm just going to check the left side to see if there's any problem here. Is it tender or sore in here?
Mm-hmm.
Here?
No.
Here?
No.
Here?
No.
Or here?
No.
Okay, it's just the bottom two. So I'm doing reducing on the left side as well, just because there's some local problem. Now, although without a doubt L1 to L5 cover the area of the right leg which has the sciatica pain, I'm just going to check S1 and S2 as well. Any tenderness or soreness here?
Mm.
No?
Not really.
Or here?
No.
Here?
No.
Or here?
No.
Okay, so we've covered the area. I've done the kidney formula plus the appropriate Hua Tuo's points and governing meridian points, and the above the pelvis and the below the pelvis extra points. What I'm going to do now is work my way down the right leg. So the first point that we do is located halfway between the greater trochanter and the iliac crest. So halfway between the two is here. And this is gallbladder 29. A bit tender, yeah?
Mm-hmm.
So, I'm just going to acupuncture that one. Here we are. And that's done diagonally up against the direction of the gallbladder meridian. Now, I'm going to have to come around that side. So I'm just going to cover over this area. It's always important to keep the patient covered so they don't catch a chill. So the next point is gallbladder 30. So to locate gallbladder 30, you place the index finger of the right hand on the hiatus of the sacrum, the high point of the sacrum, and the index finger
Karen's recording.
of the hand on the greater trochanter, and you then make thirds. And gallbladder 30 is 1/3 of the distance. It's in the depression formed when the glutamus maximus muscle is flexed. Is it tender in here at all?
So isn't that okay?
So that's gallbladder 30. There we are. So that's the control point for the sciatic nerve. Now, we're going to go down the bladder meridian on the back of the leg. That's in the fold. And then 6 inches below that is the next point.
Are you laughing or crying?
Now going down the outside of the leg, gallbladder 31. Cover this over. And gallbladder 34. And 3 inches above the apex of the lateral malleolus is 39, or you can slide along until you get to the depression. So we've gone in the reducing direction against the bladder meridian and the reducing direction along the gallbladder meridian. There's some additional work you can do when treating sciatica. So, because often the tendons go tight in response to the pain, we're going to not only do gallbladder 34 on the right leg because of the pathway of the pain, but we're also going to do gallbladder 34 on the left leg, so that both gallbladder 34s, which is the control point for the tendon, can relax. And the next thing we're going to do is to further help the kidneys stay strong, to strengthen the lower back. We're going to strengthen the kidneys from the extremities by doing kidney 3 reinforcing on both sides. And to balance kidney 3 reinforcing, I'm going to do bladder 60 reducing. Now the point which reduces inflammation in the whole body is liver 3 reducing. So we're going to do liver 3 reducing on both sides to reduce inflammation in the whole body, but of course it's mainly focused in the lower back and the right leg.
Awesome.
It's okay. Now there's some additional extremities points we can use for lower back problems located on the back of the hand. So, between the metacarpal bones of the little finger and the ring finger, at the highest point, there's an extra point just in here, which relaxes the lower back, and that's the reducing direction. And again, between the index finger and the middle finger. So these are extra points to relax the lower back, located on the hand. There we are.
You don't do the other hand?
No, because it's only on the right side. If it was on both sides, I'll do the other hand as well.
There's a bladder 59.
Yes, we could do that as well. So, bladder 59 is located 3 inches above bladder 60. And it's an additional point that helps relax the lower back. So we're reducing the pain, inflammation, swelling and discomfort in the right leg by going reducing against the direction of energy on the 2 meridians which are closest to the pathway of the pain. In addition, we're treating the condition by inhibiting the hyperactivity of the nerve and reducing any soft tissue inflammation pressing on the root of the nerve where it emerges from between the vertebrae by using Huator's extra points. In addition to that, we've done the kidney formula to strengthen the composition of the bones because there could be some swelling on the bones, pressing on the nerve where it emerges. And then, because the nerves go across the lower back and down, we've done the above and below the pelvis points to cover the area. We're now going to warm up the back. Thumb forwards on the right side with the right hand is the reinforcing direction when you're doing needle manipulation, and also the same when you're heating. It's going to be thumb backwards with the right hand on the left side. So I do this 9 times. 1, 2, 3, 4, 5, 6, 7, 8, 9. And I do that overall 3 times. But for these points which needs to be reducing, it's thumb backwards 6 times twice. Plus I can go along the meridian lines in the direction the needles are pointing. In this case it's the reducing direction, so down the governing meridian and up the quatorze. 5, 6. Thumb backwards, gallbladder 29, because she's got a problem with the greater trochanter. 2, 3, 4, 5, 6. That was 6 twice. Then I can do 6 twice on gallbladder 31, and 6 twice on these bladder meridian points. But also I can go against the direction of the energy flow. Along the bladder meridian, 5, 6, and against the direction of energy flow on the gallbladder meridian. 6. And just a little bit more warm. This is called bird's pecking method. So it's not reinforcing or reducing, it's just up and down. You can also combine bird's pecking with reinforcing or reducing. So if you were to combine it with the reinforcing method, you'd go 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. Was that? It's one more. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3. And that was bird's pecking combined with reinforcing direction, heating on the kidneys to strengthen them, to strengthen the lumbar vertebrae and the bones in the lower back. And it was reducing all the other points to reduce the pain, swelling and inflammation that's running across the lower back, through the pelvis and hip, and down the right leg. So when we take the needles out the back, the needles which are in the reducing direction, you stretch the skin and rotate thumb backwards. But if it's with your right hand on the left side of the body, it's going to be thumb forwards, stretch the skin. These quator points are on the right hand side of the body, so it's thumb backwards, stretch the skin, thumb backwards. And these quator points are on the left side of the body, so with your right hand it's thumb forwards to get the reducing direction. The governing meridian is thumb forwards for reducing, so you stretch the skin. Now, these remaining points, bladder 23, 24 and 52, are all in the reinforcing direction. So you cover the area and do thumb forwards to keep the energy in. And reinforcing on the left side of the body with your right hand is thumb backwards. Mm-hmm. So stretch the skin to release the energy for reducing, cover the skin to keep the energy in for reinforcing. Now that we've removed the needles, we're going to do cupping over the affected area. So we're going to do the center and slightly to the right. all the way from L5 up to L1. Now you'll observe that with these 3 cups, we haven't covered the area between the cups as well. So we'll leave these on for a moment, then we'll take them off and put 2 cups here and here so the whole area is evenly covered. The cupping drags scar tissue, blood stagnation from the deep layer up to the surface, where the surface circulation can more easily clear it away. So the traumatic injury that the patient has on the lower back, the scar tissue from that injury was pressing on the root of the nerve where it emerged from between the lumbar vertebrae, causing a referred sensation down the leg. Cupping after acupuncture is a way to clear away that traumatic injury and speed up the healing. So now we can take these cups off and place cups in the areas which weren't previously covered. In the gaps between where the other ones were. So, after we remove the cups, we're now going to put some tiger balm on the area, but instead of just putting it on the area in a general way, we put it on in a very specific way. We're going to go down the governing meridian and up the Wators. So we go down the governing and up the Wators. So the way that we're massaging the tiger balm into the body is in the reducing direction, against the direction of the governing meridian and against the direction of the energy flow of the Wators points. In addition to massaging the tiger balm in the reducing direction, after we've done this 3 times, we start to feel with our middle finger and index finger the position of the vertebrae, and we're checking that they're correctly aligned and in a straight line. And if we notice that they're off to the side, we can reposition them. It's not possible to reposition a vertebrae if you haven't done the acupuncture first to relax the surrounding muscle. So let's see if they're in a straight line. Yeah, they're mostly straight. So we're just going to massage the tiger balm in across the lower back. And that completes the treatment for sciatica.